Hello everyone. So this is Adam Parrott and I'm just going to run through some slides. Concepts for mechanical lung ventilation using off-the-shelf components. So just to remind ourselves of our urgent need. Globally, the demand for lung ventilators far outstrips supply. The existing lung ventilators currently have to be rationed. Doctors have to decide who to prioritise for treatment and who to pass to palliative care. Hundreds of thousands of ventilators may be required in coming weeks and months. There are design solutions, which we will come to in a following short video. But I think there's a really important question that we need to address, and something that needs to be framed when we're considering these devices, how they work and their capability. But what we want to do is we want to provide people who would otherwise have nothing, we want to provide them with an opportunity to survive where otherwise they wouldn't. So without ventilation, some patients will die. The existing regulatory framework is not suitable. So instead of how safe is this machine and following the technology qualification processes, etc., we don't have time for that. But what we do have time for is to provide a machine that's going to increase someone's chances of survival. So we need a regulatory change. We need for governments to change the law so that doctors are allowed to use these machines at the point of care. We're going to need volunteers to help operate these machines. These new concepts are going to be completely alien to anything a medical professional has seen in a hospital. They're not a clean white box with a nice user interface. They are pipes, they are pumps, they are water levels, they are pressure settings. We need people who can translate the wish of the operator into making this contraption work. So fundamentally, there's the same set of parameters that control our machines as you would expect on the previous machines. So we need to build what we can with what we have. Ventilator construction needs to start now. Parts available for bulk machine are commonly found in the concepts that we will discuss. More complicated components can be modularized. So the concept with this modularization is that, for example, if we need to have a rotating wheel that provides the periodic rhythm for an inhalation of a patient, there are many ways in which you can rotate a wheel at a fixed speed. So, for example, a stepper motor, for example, a DC motor with a regulator and an adjustment. I'm quite keen to avoid, where possible, the necessity for sensors in the control loop for a first generation machine. So machine build can be modified to fit with what is available at the time, and that's one of the really important things here. We're coming up with a concept for which it can be modularized. If you don't have one part, then we could adjust this so that it fits in a particular different scenario. Okay, so I now make this a separate video.